Good day, everyone, and welcome once more to my channel, Background Health. On today's episode, I'd like to discuss a disease that has been on the news lately, prostate cancer. As some of you may know, former US President Joseph Robinette Biden was recently diagnosed with advanced stage prostate cancer. And so this has been on the news. Before I proceed, I want to tell you what the prostate is. The prostate is simply a male equivalent of the uterus. Women have uterus, men have prostate. They are both part of the reproductive organ system. But the male prostate can also impact your urinary system. And so, before I proceed, I'll tell you about two disease entities, the prostatic enlargement and prostate cancer. But my focus will be on prostate cancer. I mention benign prostatic enlargement because those entities have similar symptoms but different consequences. So I'll show you a small demonstration to make it first clearer what I'm talking about. As you can see here, I have this contraption. Up here is this bottle, which represents your bladder. Your bladder serves mainly the function of storing urine until you're ready to urinate. When your bladder is full, you squeeze your bladder to force urine to come out through this tube called the urethra. The urethra conveys your urine through through the center of your prostate. It goes through the center of your prostate just like this. And this portion of this urethra is actually going through your penis to convey urine to the outside. Now, in either prostate cancer or benign prostatic enlargement, the prostate may be enlarged. And when the prostate is enlarged, what it does is that it squeezes, as it gets bigger, it squeezes on the tube that passes through the center. The compression of that tube here, this tube, causes backup of urine. The backup of urine causes the bladder here to swell up and enlarge, which in turn causes urine in your kidney to back up, causing your kidneys to swell up, and your kidney may fail. Now, the symptoms that you may experience are: one, you may have decreased urination at first because your bladder is full, or you may have increased frequency of urination, in which case you go to the bathroom often but don't urinate a lot. You only pass small amount of urine at a time. Or when you go to urinate, you find yourself straining, contracting your belly to squeeze urine out. And even then, you find out that you don't empty your bladder completely. You may find yourself, adjusting your lifestyle to avoid places that may make it difficult to urinate. You may begin to alter what you do. You may have some dribbling in your undergarment and urine smell, which will affect your quality of life and your social life. But some men may also wind up having frequent urinary tract infection. Those symptoms may be common to either prostate cancer or benign prostatic enlargement. But in prostate cancer alone, you may begin to have bone pain, pain on your spine. This is a symptom of advanced prostate cancer that has spread to other organs. And hopefully by the end of this discussion, we'll learn to avoid it. Now that we understand the differences, we want to talk about how frequent prostate cancer is. For men who are under the age of 50, 1 out of 350 of them may be diagnosed with prostate cancer. When you think about it, it is rare, but it's also far more common. And the odds of having it is far greater than the chances of winning a lotto or lottery. Now, for men between the ages of 50 to 64, 1 out of about 52 of them may be diagnosed with prostate cancer. As men reaches the age of 65 and above, of course, the frequency increases by age, and the frequency may be somewhere between 1 in 3 to 1 in 6 men may be diagnosed at some point with prostate cancer. Now, if somebody is unfortunate enough to be diagnosed with prostate cancer, the next question is, what are the survival rates? What are your chances of survival? Well, this depends on the stage at which the prostate cancer was diagnosed. If somebody is diagnosed with early stage, i.e. stage 1 or stage 2, at 5 years, nearly 100% of those men in stage 1, stage 2 will still be alive. However, if somebody is unfortunate to be diagnosed with stage 4 prostate cancer, which means the cancer has spread to other organs, including the bone, metastatic prostate cancer, only about 1 in 3 of them, or 33%, will still be alive in 5 years from the time of that diagnosis. So that's very important. Now, next question is, how is prostate cancer diagnosed? Well, the first thing to do is something called screening. If you are a man and you're in your 50s and you have a family history of person with prostate cancer, I recommend you get a PSA done. Very, very important. Now, the next recommendation that I'm going to mention is based on what we call United States Preventative Services Task Force. There are other recommendations, but USPS Task Force recommend that if you are a man between the age of 55 and 69 years old, you meet with your primary care physician, have a discussion about whether or not you should have a PSA done. Based on your discussion of risk factor, etc., and the implications, if you decide to proceed, they will order a test called PSA. If the PSA is high, it doesn't necessarily mean that you are or that you have prostate cancer. It may still be BPH, but the higher the number, the more likely it is prostate cancer. Once the PSA is high, the doctor may decide either to monitor the level and repeat it several months later, or to proceed with further investigation, which may include ultrasound or CT scan of your prostate. If the CT scan or ultrasound shows a tumor, something suspicious for cancer in the prostate gland, your doctor may recommend biopsy, and biopsy may confirm the prostate cancer. Once a prostate cancer is confirmed, your doctor will do other investigations, which include CT scan of all organs in your body to see whether or not there's evidence of metastasis or spread of the prostate cancer to other organs of your body. And following that diagnosis, the next thing is, how is prostate cancer treated? Well, treatment depends on stage. For people with early stage prostate cancer, especially stage 1, the doctor may elect to simply monitor the PSA, monitor the ultrasound, and see if there's any changes occurring. If there's changes occurring, the doctor may then recommend several interventions, which may include surgery, which may include removal of the prostate, it may include removal of the testicle, etc. So many different surgical options. Whichever option is selected, following that, your chances of survival in stage 1 or stage 2 is close to 100%, although they have implication of the intervention. But once it gets to stage 4, then the options of treatment are limited. You may undergo chemotherapy, hormonal therapy, etc., but the chances of survival, as I mentioned earlier, drop significantly to only 1 in 3 of such patients surviving to 5 years. So, as I conclude, regardless of whether you're a man or a woman, you should be concerned. For women, you think about men in your life. It could be your husband, your partner, your brother, your uncle, your father. If you think about it, encourage such men to get help, to seek screening, evaluation, because you can save life. It help improve somebody's quality of life. Thank you for listening and tune in as we explore other topics. Please share this video to save life and continue to help other people till we meet again.